Good afternoon and welcome to the second in our series of 3 webinars presented by Vermont Information Technology Leaders. This series covers important topics related to the CMS Meaningful Use Incentive Program in 2014 for eligible professionals. Today we will be focusing on implementing a successful patient portal. My name is Rob Gibson and I'm the Vice President of Marketing and Business Development at VITL. I'm joined today by members of our eHealth Services team. VITL's eHealth Services team brings clinical and practice management experience to you and your practice as you strive to achieve meaningful use. Ann Gilmette will be our presenter today, Suzanne McEachran and Jennifer Morgan will be panelists. Before we get started, let's cover a few logistics for the call today. You can interact with us through the instant messaging features in your GoToMeeting window. Please send questions as the presentation proceeds. If possible, our panelists will answer your questions real time. Other questions will be queued up for discussion during the Q&A period at the end of the presentation. We will also be monitoring our Twitter feed using the hashtag VITLMU. Before we start today, we're going to do a few polling questions to get a sense of the audience that's with us today. So the first polling question, which should appear up on your screen, asking you what is your job role. So if you would take a moment to answer that polling question for us. Okay, it looks like we've got a good response to that. I'm not able to see the poll responses, so I can't share those with you, but you can see them. You should be able to see them on your screen as a participant. So, okay, so it looks like most of our folks are split between being a practice manager or administrator and part of the IT organization at your practice. So that's good. All right, our second polling question is about attestation, and we're asking whether you and your organization are attempting to attest to Stage 1 or Stage 2. So if you could take a moment to answer that question for us. Okay, we got about 3/4 of you. Anybody else going to answer for us? Okay, so let's go ahead and close that question then. All right, about half of you in the audience today attesting to Stage 2 meaningful use. Okay, thank you. And then the final question, as you know, meaningful use Stage 2 requires a 90-day reporting window in either calendar or fiscal year 2014. So we're asking which quarter, which 90-day period are you planning to use as your 90-day reporting window? Okay, you got a little over half of us answering, up to about 3/4. And anyone else in the last seconds? All right, so thank you for that. So let's go ahead and close that question. All right, looks like some of you are trying to get a start with the 3rd calendar quarter of the year and then others later in the year. Okay, thanks. This is all good information for us as we try to understand your needs here at VITL. Okay, so without anything further, I'm going to turn the microphone over to Ann, who will take us through implementing a successful patient portal.
Thank you, Rob. Good afternoon, and thank you for taking time out of your day to join VITL's webinar, Implementing a Patient Portal. I've been employed at VITL since July of 2013, and previously I worked for a large primary care group in Vermont. One of the last projects I helped roll out was the implementation of a patient portal. I have to say it was a lot easier than implementing an electronic health record. Today's webinar is designed to show the value of implementing a patient portal, how a portal could help your organization meet the next stages of meaningful use. I'll be talking a lot about patient engagement. If you are in the beginning stages of adopting a patient portal, ideally look for a portal solution that can seamlessly be connected to your EHR and practice management system. I recommend working with your EHR vendor for the best solution, and if you would like assistance from VITL, please contact an eHealth specialist. We would be happy to help you, and one of the slides at the end does give contact information, so that'll be available to you after this webinar. What is a patient portal? A secure online website that gives patients convenient access to their personal health information. A patient can log into their portal day or night, 365 days a year from their computer, phone, or iPad. A lot of portals now are offering an app that can be downloaded onto your iPhone. Patients can view upcoming appointments. A clinical summary from today's visit can be sent to the portal. Medication list can be viewed, request a refill, lab results. Having the right technology is key for patient engagement. The portal needs to offer useful information if you want patients to utilize it. Your portal can enhance provider communication through secure messaging. The patient can view and print patient education material. A portal can help streamline front desk tasks and registration, scheduling of appointments, and patient reminders. Most portals can be customized for your organization. If you decide to implement online bill pay, a portal could increase revenue and help you achieve meaningful use and receive incentive payments. So I want to highlight a few of those again: clinical summary, secure messaging, patient education, and patient reminders. All meaningful use measures and tasks that are already being done, most likely by printing paper or using a telephone. Why use a portal? Once again, patient engagement. Patients want to be able to collaborate, connect with their healthcare team, and hopefully a portal will offer value to both the patient and your organization. Over the last few years, there's been a lot of discussion how to engage patients in their care, and today it's vital to your business. Patients are expecting and demanding greater control over their care. When a patient can easily communicate with their provider, they feel connected. This is sad to say, but I feel more connected to my friends and family now using text and email than when I had to call them. For me, it comes down to convenience, and a portal definitely is convenient for the patient. Patient engagement is active collaboration between the patient and provider. Patients want to be able to view their chart. This does not mean progress notes. You can customize your portal to only send certain parts of the chart. I know that that's always a concern, thinking that the entire patient chart will be sent to the portal, and that's not the case. When you are purchasing or looking for a portal, you can find out your options for customizing what can and cannot be sent. Patients want to be able to communicate and collaborate on a wide range of health information. They want to be part of their healthcare plan and health tracking. This could be in the form of filling out a blood pressure log online, printing it out, and bringing it to their next appointment. Little things make them feel involved and connected. Having access to their medication list aids them with prescription management and decision making. A portal can be a win-win for the patient and for the healthcare, your healthcare organization. It should be set up to offer value to both parties. For the patient, it offers easy access to their medical record, quicker access to test results, convenience of making appointments and requesting refills, and secure messaging. For the office, hopefully you see less phone calls coming in. Online forms can be completed before the patient arrives for the appointment, using less paper. Messages are electronically placed in your EHR. If they come in through a secure message, they're placed in your EHR and translation is not lost. A lot of times if you're taking a message through the receptionist to the clinical staff, and by the time it makes it to the EHR, a lot of the content is not there. A portal can improve current workflows that are consuming and cost the organization money. Example, mailing out normal lab letters. Think of the amount of time and cost that is to your organization. So all things that add value to your organization if you were to implement a patient portal. The link between your patient portal and meaningful use. You will have better success meeting meaningful use requirements if you integrate a patient portal effectively in your practice operation. In addition, Stage 3 requirements may require that you use the patient portal to attest successfully. So effective implementation of a portal will help you attest to several patient and family engagement-driven requirements for meaningful use. If you already have a portal, work with your vendor to understand whether it will meet industry mandates for patient and provider use. Make sure it's secure and efficient. Talk to your vendor about upgrading your portal if not 2014 certified, and plan ahead so you don't miss meaningful use deadlines. Now I'm going to get into talking about the actual objectives for meaningful use, Stage 1 and Stage 2. You could, if you choose to implement a portal, you could use a patient portal to satisfy 4 meaningful use measures in Stage 1, 2 core and 2 menu. Provide patients so core objective number 12 is provide patients the ability to view online, download, and transmit. So 50% of all unique patients are provided online access. And I'm going to get into more detail about what online access is on the next slide. And then core objective 13 is provide clinical summaries for patients. And menu objective number 6 is use your EHR technology for patient education. And then number 4 is send reminder. It's also a menu, and it's send reminders to patients. So if you've already attested to meaningful use Stage 1, you're familiar with all of these objectives. And I'm going to go on, and as I said, I'll get more into detail about each of those for Stage 2. So for meaningful use, Stage 2 has 2 core objectives that will require some form of electronic access and transmission according to the transport standards set in CMS final rule. Therefore, for the purpose of meeting core objective number 7, electronic access, and 17, secure messaging, the capabilities provided by a patient portal, personal health record, or other means of online access would meet the requirements for these 2 measures. I want to get into a little bit more about, core objective number 7 in meaningful use Stage 2 is provide patients the ability to view online, download, and transmit their health information within 4 business days. So this is also a core objective for Stage 1. In Stage 2, it has 2 parts, the 50% and the 5%. So for Stage 1, it's 50% of all unique patients are provided online access to their information, and that's also in Stage 2. So provide 50% of your patients with online access. What does access mean? It's defined as the necessary information needed to view, download, or transmit their information. This could be in forms of giving them instructions how to access a portal, a website address they must visit, a unique username and password, or any other instructions, tools, or materials they would need to access their health information. So just to give an example, 50% may sound like a lot. If a provider sees 1,000 patients in the 90-day reporting period, 501 patients would need to be given some form of tool or instruction to access their information. So that is inviting 501 patients to join a portal. That does not mean 501 need to register for the portal. So it's just giving them the tools they need to access their information electronically. So that's for Stage 1 and Stage 2. Part 2 of the question is 5% of all unique patients need to view, download, or transmit their information. Using the same example, 1,000 patients, and 1,000 patients is a reasonable number for a full-time provider in a 90-day period. 51 patients would need to view, download, or transmit. So 51 out of 1,000 patients is really not a lot of patients. If the patient signs up for a portal and the portal offers value, they're going to be more than likely, 51 patients will be more than likely to use it. They will view their chart. Others may download information and print it out. An example would be immunization graph for a school nurse, blood pressure log to bring to a specialist. A few patients may try to transmit their information to a third party if available. If your portal offers value to the patient, a provider should not have a problem meeting this measure. And one thing I would recommend is work with your vendor to make sure you understand how you will capture the numerator for the first part of this measure. So for 50% of your patients, if the front desk is handing them out some type of instruction or tool, where is that being marked in your EHR or your patient portal to be measured? So that's an important one. Core objective number 8 is provide clinical summaries. This is for stage 1 and for stage 2. 50% clinical summaries are provided. In stage 1, it's 3 business days, and in stage 2, it's 1 business day. So that's the change between stage 1 and 2. Clinical summaries can be printed or mailed. The most efficient way would be to send a clinical summary through a patient portal, saving on paper and time. This is an opportunity for your clinical staff to introduce the portal and ask the patient if they've signed up. If they have, let them know they can receive their clinical summary for today's visit electronically. Stage 2 continued. So all core measures, these are all core measures for stage 2. Use clinical relative information to send patient reminder appointments. That was a menu in stage 1. It's core for stage 2. Using certified technology to identify patient education. Core for stage 2, menu for stage 1. And core number 17, use secure electronic messaging to communicate with patients. So for information as far as reminder appointments, 10% of unique patients who have had 2 or more office visits with the EP within 24 months are sent a reminder in an electronic form. Educational material does not need to be stored within or generated by your EHR. However, the decision to provide material should be based on information stored in your certified EHR. The provider can use a problem list, med list, or lab results to identify educational resources specific to the patient's needs. You'll want to ask your EHR vendor how the numerator is also calculated for this measure. That's important to know. For using secure electronic messaging to communicate with patients, secure means only the intended parties can access the message. This could be in the form of email, an online patient portal, or any other secure electronic means. So 5% of your patients you will need to be communicating with 5% of your patients electronically. And if you do implement a patient portal, patients will be sending messages into the office. They'll be requesting appointments and refills. So 5% will easily be met. So that was, talking about the meaningful use measures and how implementing a patient portal could help you meet those measures. If you need more information and detail about the measures, we can, feel free to ask questions at the end or contact any health specialist. I did not get into exclusions. There is exclusions for all of those measures. So now I want to talk more about the launching of a patient portal and steps that should be taken before you implement, and then we'll go into implementing and then ongoing education and promoting of the portal. Preparing for a portal, you really need to start by enlisting your practice stakeholders and forming a team. You want to have meetings on a regular basis. Identify clinical and administrative champions. You may want to think about picking champions that were not on your EHR team and involving different and other staff. Consider staff that understand patient engagement and have an outgoing personality that will help with promoting the portal. Consider including one person from each department so that you're bringing a team together, and it will help market and sell the portal if you have involvement from several teams in your office. Implementing a portal does not, you don't need a strong technical background. So once again, if you had technical staff on when you implemented your EHR, you may want to think about involving different staff this time. Once you have a team, make sure everybody understands the benefits of meaningful patient engagement, including meeting the meaningful use requirements. Address concerns with the team, talk about solutions and a way to avoid possible issues before they arise. Make sure the team is well trained and is comfortable using the portal and performing required tasks before training all staff. That's really important because they need to be trained so when you do implement your portal that they will be able to answer questions for the other staff, and more importantly for patient calls coming in. So training is big and it's ongoing. You may want to consider defining a vision and set goals. Understand where you are now and where your organization wants to be with patient engagement. What does patient engagement mean to leadership, your staff, and the patient? After you create a vision, think about what the end state could really look like when you have strong patient engagement in your office. A sample end state vision, the phone is quiet, nobody is on hold, patients flow in and out having been reminded of their appointments electronically. New patient paperwork is completed before arriving for their appointment so that they're not taking up half their appointment sitting in the waiting room filling out paperwork. Prescriptions are submitted electronically during the exam. Loud printers are not spitting out lab results or clinical summaries. Messages are not piling up for the provider because most have arrived via secure messaging, and nurses are already prepared answers for most of them. And the provider can answer the message when convenient for them. They can send the message on with a click, and now patients are prepared and informed, and you have met your patient engagement requirements for meaningful use. So consider thinking about a vision and then what an end vision is, and that will help staff get on board and understand a little bit more about the importance of a patient portal and engaging patients. Staff involvement. Staff involvement, they need to feel valued. They need to be aware. Once again, I don't think a lot of times staff understand what patient engagement is. Initially, it was talking to the patient when they were in the office and setting a goal, but now it's really more about them, being able to be connected to their office and to being able to help make decisions. So getting practice-wide support is critical in implementing a successful patient portal, but it doesn't have to be hard. When creating your vision, get input from all staff. They're more likely to be enthusiastic and get involved. Make sure staff know they are valued and they are critical to successful patient engagement. If your front desk isn't involved and they're the ones that are trying to hand out the tools to the patient, it's going to be hard for them to do that. So make sure that everybody understands that they're critical to the success of patient engagement and implementing a portal. They need to know why engaging the patient is important, and they need to be fully trained and given the tools needed to perform the task that's going to be asked of them. Work with them to write a script to have at the front desk to reference. Address any concerns they may have and reassure them technology will not replace them. That's always a concern if introducing new technology, staff may have a concern that that they're not going to be needed if certain tasks are now done electronically. So reassure them that that's not going to be the case. Adding fun is important to the process. Rewards, recognition, be creative. Pizza party, ice cream social when certain goals are met. Maybe a competition of who can get the most patients registered. You can have a giveaway at the end. I created a visual chart that looked like a thermometer, and every day I would update it and so that they knew how many patients were registered. I'd talk about it, promote it, get excited about it. So think about ways that you can add fun into the process. You may want to set goals by department, number of registration, registrations for the front desk, but for nursing staff it may be the number of secure messages that came in and reduced phone calls. So try to be creative, set goals, but add fun to it. Workflows, look at your current workflows, clinical and administrative. How are tasks currently being done? How will they change with a portal? Use findings to help create your policy and your procedures. Still phase one before you've actually implemented your portal. You'll want to be thinking about how you will measure success. Refer back to the vision you created and set achievable targets. You don't want to set goals that you won't be able to reach. That's discouraging. One example is track portal registration. Currently, you have zero patients using the portal. You want to get an X number of patients signed up in an X number of weeks and months. So how are you going to measure success? What is important to your organization? Involve the staff, see what they would like to track, and make it a group effort. Policies and procedures. Think about policies and procedures before implementation, and then you may need to tweak them as you after go live. Check with your vendor. They may have a training manual or guidelines for your reference. Look at your current policies. How are those policies going to change for portal use? You're already doing these tasks, but maybe not in electronic form, so a policy may already be written. It will need to change. Is your current policy to return phone calls within 3 hours? Will that change for messages coming in via the portal? Is a good example of a policy you may already have written and it will need to be changed for the portal. Configuration and testing. I have to say probably the biggest question that comes up when you're configuring or thinking about adopting a portal is proxy access. It's always a concern. Determining how your organization will handle inviting patients between the ages of 12 and 17 will probably be the biggest decision you'll need to make. Finding out how you can configure your portal before you're purchasing it is probably is big. You want to know how that piece works with the portal that you're going to be using. There's no laws in place, and leadership will probably have to make the final decision in your office. Think about how you handle requests for records now for that age group. Is that going to change? Do you release records to the parent for a 16-year-old? Will that change with it when you implement a portal? The organization I worked with invited, parents were invited on behalf of the child if they were between the age of birth and 12 years. And when the patient turned 13, the system was configured to stop sending new information. The parent would still have access to the old records. And once the patient turned 18, the account was automatically disabled, and a new invite was sent out to the young adult. So the policy was to not invite patients once they've reached, or not to invite parents to be a proxy for adolescents, the age 13 to 17. On a case-by-case, the provider may want a patient invited. If they had a 17-year-old patient going off to college that they wanted to be able to communicate with, the portal was set up so that you could invite patients in that age range. So an invite would be sent. Another example is if a disabled 16-year-old that a parent will always be a legal guardian for, they were sent an invite. And that seemed to work very well. There was very little issues. Sometimes it got a little sticky if the family had a 10-year-old and a 13-year-old, and they had an invite to view the 10-year-old's information, but not the 13-year-old. But usually, once we explained our policy, it was fine. Another area that you might want to think about or could cause some problems is if a parent is going through a custody battle or a divorce and having access to which parent gets access to the record. Sometimes if both parents have access, they can view the other patient's demographic information. But that didn't happen often. It was you probably have those situations in your environment now. You're going to have to think about how you're going to handle those using a portal. Configuration and testing. Understand what features are offered, which ones you will activate at the time of go live. Your portal, you may want to start with the basics so the patient can view their chart, download information, request appointments, and offer secure messaging. Go with what you need to offer to reach meaningful use. A few months down the road, you may want to activate online bill pay or online forms. From my experience, those two options, the online bill pay and online forms, require some setup, and you have to get your practice management system involved, and then you have to create your forms online for the patient. So you may want to not consider doing those a few months down the road at a later date. Some portals can be configured by provider or organization. Make sure you know, once again, when you're looking to purchase a portal, what your options are. If you're in a large organization and providers are going to want different options, it would be important that the portal could be set up and configured by provider. Other things to think about: how and when do you want lab results to show in your portal? After they've been signed off, before they've been signed off? Do you want them to, be sent in 3 days, 7 days? Maybe normal results are sent in 3 days, abnormal are sent in 14 days, and that way it gives the office time to contact the patient and review the results with them. So these are all things to think about as an organization before you configure or things that will need to be configured once you've implemented a portal. And talk to your vendor about your options. There's probably many. Marketing and promotion is an ongoing effort. Before implementation, consider hanging signs in the waiting room, flyers stating our portal is coming. Be excited about it. Have front desk staff talking about it. Postcards can be mailed or used as an appointment reminder card. You may want to consider changing your on-hold music or automated message, so when a patient is calling in, you're notifying them about a portal coming soon, ways that they may be able to sign up. So marketing and promotion is ongoing. So phase 2 is actually launching the patient portal. You'll be implementing, and it's the go live phase. You should focus on the service being offered. You're going to want to get feedback from your staff and patients. You're going to want to be able to address issues and concerns timely, make changes if needed. The majority of questions I saw generated the first few weeks were login issues, questions about how to use certain features in the portal, and then problems logging in as a proxy. From my experience, I don't feel, I think there could have been more training with staff on how to use the portal. They're trained how to market it and get patients signed up, but if they're not a user of it, they don't know how to answer the questions that the patient's asking about the different features of the portal. So I would recommend, having your staff actually log in and be familiar with actually using the portal as a patient. You could set up test patients to do that if if staff didn't want to join as a patient. Use some test patients, but make sure they're familiar with the features of the portal and how to use it, because they will have questions. So training the staff to be comfortable answering them, or maybe you want one staff person dedicated to answer questions. Start thinking about tracking the success, review the predefined measures, and look at your goals. So back to what you defined for goals before going live, revisit those. That helps keep staff motivated. Think about maybe designating staff to help patients with registration and use. Consider setting up a registration station in the waiting room. You'll need staff available to answer questions. For getting patients signed up and involved, the ideal would be that they do it on site when they're in the office for an appointment, but a lot of times there is not extra staff available to allow that. One of the offices I worked with actually had an intern, a college student working for them, or just an intern, so they were able to put that person out in the waiting room, introduce the portal, and help patients sign up. So that was ideal. Try to engage patients and ask about their experience using the portal. You could mail out a survey. You could send them a secure message. If they reply back to that message, that's going to help with getting your 5% of secure messaging. Continue to educate the patient and the staff about the benefits and the appropriate use. Is the front desk educating patients during check-in, offering tools? A lot of times, the first few weeks, all staff are on board and really, pushing the registration, and then after time, it slows down, and you're always going to have new patients coming in, and it's important to keep up that momentum of inviting patients. A lot of times, if staff are not still marketing or promoting, they may just not be comfortable with it or have a lack of understanding. So making sure that they're, once again, fully trained, having a script at the front desk to help them introduce the portal is helpful. Encourage your clinical staff to be involved, trying to get patients to sign up. It's not just a front desk task. Nurses, when the nurses are drawing a patient's blood, they can ask them to check their portal to review their lab results. If they're not part of the portal, have information and tools available for the clinical staff to hand out to the patient. Are providers mentioning the portal as a way to access their clinical summary from today's visit instead of automatically printing it out? A physician asking a patient if they're part of the portal, really means a lot more than when a patient's checking in, they're getting so much information and registration and copying their insurance card. Introducing the portal is just one more piece of paper, but when their physician asks them or provider asks them if they're part of the portal, it really helps with the registration and getting patients signed up. Once again, you still need to be promoting. You may want to think about t-shirts and buttons. You can have a prescription, how to request prescription banner or poster in the waiting room. And then once again, your follow-up appointment cards can have information on it about the portal. And then on to, so once you've implemented your portal, you're going to still want to have continued support and education. And as I said before, you're always going to have new patients coming in. So making sure that the registration and inviting patients to join is still happening. You're going to want to do continuous quality improvement is important. Make adjustments as needed. Review your policies again. making sure education to staff and new patients if you're enrolling are going to be rolling out new features, or when there's an upgrade there may be new technology that staff and patients will need to be trained on, so keep that in mind. Talk to your vendor about an upgrade schedule. Make sure you know the cost. Run and understand your reports to achieve meaningful use early in the implementation stage. You don't want to assume that your portal is capturing your numerator for you in it, the last day of your 90 days. So make sure you understand how to run the reports and how you're capturing the information needed for meaningful use. You want to still continue to promote. You may want to think about a video in the waiting room, update your website. Maybe you can have a link on your website that gets you right to the portal. So put up a big banner in the waiting room and update your recorded message. So just some suggestions for ongoing marketing and promoting the patient portal. Common concerns. There's always some concerns, usually from the providers or the clinical staff, flooded with secure messages, inappropriate use of messaging, the provider unable to bill for time that they're spending communicating online. Patients may be upset or confused by information that they see in their medical record. This just usually comes from not understanding a diagnosis on their problem list. And then patients won't adapt to using a portal. Concerns are real, and you should address them with patients and staff. But remember, you should be able to reconfigure your portal if it's not working for your organization. With my personal experience in talking with organizations using portals, there's very little problems with patients abusing messaging. If a patient is abusing messaging, maybe you can block that patient. Maybe they just need additional instructions or education. And you should have the option to mark the message complete and then call the patient if the message is being passed back and forth several times. But as I said, I saw very little of that. And it was just came down to, educating the patient, and then it was resolved. I've seen increased efficiency because staff and providers can respond when convenient and the message is short and to the point. A lot of times staff and providers will get on the phone with the patient and they spend 15 minutes talking about personal things and not getting to personal things other than their medical history and what the intended question was. So I think messaging is actually quicker and to the point. Secure message, secure messaging, I think it's direct and it's efficient. And when setting up the portal, provide clear expectations. All messages will be addressed within 2 business days. If this is urgent, please call the office. So make sure that when patients log into the portal, they have an understanding of when their messages will be returned. They may be used to getting a phone call back in 3 days, but if they use the portal, it may be, 1 or 2 business days. Hopefully there's a place in your portal that you can notify the patient. I've seen the elderly and people with chronic illness and people that are not in an area with great internet all adapt to using a patient portal. So most patients favor using online tools to communicate and obtain their appointment and result information. And then the last slide that I put in here is purchasing a portal. I didn't, I'm not going to get into detail, but these are some important features that I, felt that you should look for. It needs to be user-friendly. Online bill pay is, not all of them offer that, but if it's something that's important to your organization, you may want to look at that. You're going to need the secure messaging. Patient registration should be easy, user-friendly. You want your portal to be flexible so you can add and customize features. It needs to be compliant. You may want to look for a low upfront cost and low financial risk so that if the decision, you made the wrong decision, you can switch. And then easy upgrades and excellent support. And support's always an important one when you're purchasing or rolling out new technology. So thank you for spending time with me today, and I'm going to hand the last few slides back over to Rob, and then we will have some time for questions and answers.
All right, thank you, Ann. Just as we wrap up here, I wanted to remind folks that VITL eHealth services, eHealth specialists are available and located around the state of Vermont to assist you in implementing your patient portal as well as other issues related to meaningful use. I wanted to take a moment to do 2 more polls here just to re-engage folks. So the first question, the next polling question has to do with implementing a portal. So we'd like to know where you are as an organization in your plans and your implementation of a patient portal. Take a few seconds for folks to answer. All right, we got about half of you, maybe more one can answer. All right, looks like that's what we're going to get as far as responses. There's a few more. Okay. All right. Why don't we go ahead and close that question then? All right. So it looks like folks in various stages of implementation there. So, all right, and then our final poll question: if you have a provider portal that you've already implemented, how successful have you been with engaging patients in that portal? So, do you think you've been wildly successful, moderately successful, or some of us might still have a long way to go? All right, so we'll leave this question open for a few more seconds. Okay, why don't we go ahead and close that question? All right, and all right, no one out there thinking they're wildly successful today, and folks still thinking they've got some ways to go. All right, well that's probably not surprising to us. And again, just reminding you, if you want or need help from VITL, please reach out to us. Okay, my understanding, we've had a couple of questions that have come in through the instant messaging feature. I believe those have been answered sufficiently through the instant message response. If you would like to ask a question live, and if you have the appropriate audio system set up so that you can speak to us, so you're either connected through a phone or connected through a computer headset, there is a raise your hand feature available in the webinar. And if you have a question you'd like to ask us live, just take a moment to raise your hand and do that. I will, just while we're waiting for questions, remind folks that that we will be posting the charts and a recording of this webinar within 24 hours after the webinar completes. All right, Steve, do we have anyone? Okay, so we don't have anyone raising their hands. I think we've answered the questions that we have today. So again, the replay of this webinar will be posted. Also wanted to remind, whoop, we're getting a question coming in. All right. I'll just get a minute on the logistics here to open the line. Okay, so we passed it over to Suzanne. So Suzanne, we're going to open your mic and let you read it and address the question.
So the question is, can the portal be live for the 4th calendar year quarter? And the answer would be yes. I believe that is your question. If you're asking, does the portal need to be live during your entire reporting period, which I think is the question, the answer to that is yes, it does. So before your reporting starts, your portal needs to be up and operating.
And obviously the specifics of implementing that portal would be a discussion that you need to be having with your EHR provider if that's the path you're taking to implement your portal, or a third-party portal, or however you plan to do that. Okay? All right. All right, we will Okay, we've got another question coming in. Okay, not a question there. Okay, so we do appreciate your time today and for joining us today. We will be sending a quick follow-up survey following the, you should receive by email following the webinar today. We would appreciate it if you take a few minutes to complete that webinar. And so finally, on behalf of the entire team at VITL, we appreciate your time today and thank you for joining us.